Okay, let's dive in. My name is Stacy DeSisto. I am the Vermont Health Connect Assister Program Manager with the Department of Vermont Health Access. And today I'm joined by Zach Goss. Zach, would you like to introduce yourself?
Hi, everybody. Great to be here. I'm Zach Goss, Director of Customer Communication, also through the Department of Vermont Health Access.
Thank you, Zach. Today's town hall is all about open enrollment. It's the one time of year that everyone can make changes or obtain a qualified health plan. We're going to dive into what a qualified health plan even is, what and why open enrollment is, and finally, some tips for getting the best plan for you and your family. We'll be answering all questions at the end, so if you have any that pop up during the presentation, please add them to the question and answer box. It should be at the top of your screen, also where I put those announcements. Questions placed in the Q&A box are not on display for all participants, but please avoid adding any of your personal or protected information in there. Please be aware that this meeting is being recorded. This recording and all paper and electronic copies of materials presented or shared on the screen will be subject to Vermont's Public Records Act, Vermont Statutes Title I, Section 315, and the following sections, and will be made available to the general public upon request. Participants are responsible for ensuring that no confidential or proprietary information is presented or discussed in the meeting and associated materials. This recording may not be deleted or destroyed except as provided under DVHA's record retention schedule. The mission of the Department of Vermont Health Access is to improve the health and well-being of Vermonters by providing access to quality healthcare cost-effectively. Vermont Health Connect is administered by the Department of Vermont Health Access. Vermont Health Connect is your one-stop shop for health insurance. At risk of oversimplifying it, there are two types of insurance that most folks are familiar with that are obtained through us. First is Medicaid, a state-funded health insurance designed to help eligible people in need of financial support. And then there are qualified health plans. These are the insurance plans that you acquire through Vermont Health Connect and are administered by Blue Cross Blue Shield of Vermont, MVP Healthcare, and or Northeast Delta Dental. A person or family can apply for and enroll in Medicaid at any time of the year. So today's presentation is not about Medicaid at all. Instead, we're focused on qualified health plans only because open enrollment is starting soon, which means, well, starting today. And that means there is a limited time frame to sign up for them or manage your current qualified health plan. We're going to explain all that and more in this presentation. Let's start with the reasons why someone might purchase a qualified health plan. Typically, two things are true. Number one, the person is not eligible for Medicaid or other state-funded programs. And two, they don't have access to another insurance option, like insurance isn't offered by their work, or the other option that they have is not considered affordable by federal standards. And there's a tool to figure that out, which we'll show you in a few. When these two things are true, insurance plans through Vermont Health Connect are the next option. And Vermont Health Connect is the only place you can get financial help with paying for the coverage if you qualify. But you can't just get a QHP any time of the year. There's a limited time frame to sign up for a qualified health plan called open enrollment. Open enrollment is a special time of year in which you're allowed to sign up for or make changes to a qualified health plan. It's like a season for health insurance. And just like spring, summer, or fall, it happens at a specific and limited time of the year. Another way to think of open enrollment is as the time when the doors to insurance swing wide open. The limited time to apply for and make changes to your insurance plan starts November 1st and ends mid-January, so about 2.5 months. During this time, you can make sure you have the best coverage for you for the upcoming year. At this point, you might be wondering why open enrollment exists. Why can't we just get our health insurance any time in the year? Open enrollment was the result of a law passed in 2010 called the Affordable Care Act, which made it so more people could have access to affordable health insurance. Before this law, getting the health insurance you need could be difficult. A person could be turned away or charged a lot more if they had health problems. But now, insurance companies can't refuse somebody or charge more if they have pre-existing conditions. Insurance companies also must cover essential health benefits like doctor's visits and prescriptions. To make a long story short, open enrollment is in place to help insurance be better for everyone. It stops people from only getting insurance when they're sick or hurt, which could make insurance more expensive for everyone. In addition, it's statistically true that when someone has insurance year-round, they're more likely to consistently use healthcare services, resulting in overall better health and well-being. I'm going to pass it to Zach now, who's going to talk a little bit more about open enrollment. Zach?
Thanks, Stacy. And that overview is really helpful. Just to reiterate why open enrollment is important and talk about when it happens. So remember, like Stacy said, open enrollment happens once a year for this 2.5-month period. What's really important about open enrollment is if you miss it, like Stacy said, you might not be able to get insurance until the next open enrollment. So it's really important that if you need insurance, that you look during open enrollment this year. So again, open enrollment starts today, November 1st. Our phones are open and our website is open for people to look for their plans. So open enrollment is the time when you can look for your plans, you can shop for a new plan, even if you already have a plan. You have to get your plan through Vermont Health Connect if you want to get a plan with any kind of financial assistance, which we'll go into more later. So on this slide, we have the key dates, the really important dates that are important for you to remember. So like we've mentioned, and it probably won't be the last time, November 1st, today, open enrollment starts. So it starts this 2.5-month period. Again, phone lines are open, website is open. If you don't have an account, you can create a portal account in our self-service website and do that all online. We also have assisters who are available to help you enroll if you would like some more personal help. December 15th is the next important date we want to point out. You need to enroll by December 15th, 2023, if you want your plan, your insurance plan, to start covering you on January 1st. So I'll say it one more time. You need to enroll by December 15th in a plan if you want that coverage to start covering you on January 1st. Open enrollment is not over on December 15th, but you need to enroll by then if you want a plan starting on January 1st. Open enrollment continues for another month until January 15th. However, if you choose a plan, enroll in a plan between December 16th and January 15th, which is the last day of open enrollment, your plan will not start until February 1st. So those are some really important dates for you to remember. So we're going to talk about, okay, so we've decided we want to look for a plan. How do we find the plan that is right for you, your household, your situation? So there are a variety of healthcare plans available in Vermont, and each one is designed to meet different levels of need. These plans come in what we call meta levels that you can see here on the slide. They actually don't refer to the quality of care you receive, but instead, the level you choose is all about how you and the insurance company split the cost of your care. So we're going to dive into this a little deeper. So for example, we'll take the bronze plan. Bronze plans have lower monthly premiums, but higher out-of-pocket costs when you receive medical care. Silver plans offer a balance between monthly premiums and out-of-pocket costs, making them a popular choice. And we have gold plans, that have higher monthly premiums but lower out-of-pocket costs. And they can be a good fit if you expect to use your insurance a lot. And then finally, we have platinum plans, which are the top tier plans with the highest monthly premiums, but the lowest out-of-pocket costs when you receive medical care. So to say it once more, a common misconception is that the more precious the metal, the better the coverage, but that's actually not true. The metal levels simply represent how much of your insurance you will pay monthly in relation to when you receive care. So let's talk about some key health insurance terms that are important for you to know. We've already talked a little bit about some of these terms in the presentation so far, and we're going to continue to talk about them. We're going to shortly look at our plan comparison tool, which will be one of your best friends during this process of looking for a health insurance plan. The plan comparison tool helps you compare different plans side by side and see how they stack up in terms of cost and coverage. So before we do that, we want to hone in on these terms that you'll see often, and particularly the terms of premiums, deductibles, and co-payments. So let's go ahead and define these. We'll start with premiums. So premiums are like your monthly subscription fee for health insurance. They vary depending on the plan's metal level, like we just talked about. Lower tier plans, bronze and silver, generally have lower monthly premiums, while higher tier plans, the gold and platinum, have higher monthly premiums. Then deductibles. Deductibles are the amount you pay for your covered healthcare services before your insurance plan starts to kick in and cover costs. So higher tier plans, gold and platinum, typically have lower deductibles, meaning you pay less out of pocket before your insurance begins to cover the expenses. And then co-payments. Co-payments are fixed amount of payments for services such as doctor visits or prescriptions after you've met your deductible. Different plans have different co-payment amounts for different services. It's a lot to remember, and we don't expect you to memorize all these terms. We have a list of these terms on our website and more that you can visit and reference at any time. And we're always happy to help you answer these questions, whether it be through our inbox for general questions, or if you want to talk specifically about your case, you can send us a message or you can call us. So we actually made a short video to explain how our plan comparison tool works. And we're going to show that to you now so you can see.
You may need to let me know if you can hear it, Zach. Can you hear it? Okay, bear with me, everyone. We are going to attempt to get the sound on here.
And while Stacy does that, I just want to share again with folks about how to get in touch with us. So again, they can call our customer support center to talk about their specific case. They can send us a message by their secure portal message if they have a case-specific question, like by the way they do that is actually log into their account and then send us a secure message. We don't want people sending us case-specific information through our general inbox, but that inbox can be used for general questions like explanation about a particular health insurance term or something like that. All right, Stacy, go for it.
All right.
Do you need help using the
Perfect.
plan comparison tool? First, find the shopping cart on the Vermont Health Connect homepage. You'll want to enter the zip code for where you live to get started, followed by how old you are. Being pregnant, Native American, or offered health coverage from an employer could affect your eligibility. If that applies to you, let us know. If you live with a spouse, domestic partner, or other dependent, add them using the buttons on the top, and tell us if any other factors apply. Your eligibility is based on your total household income. Enter that information and view your results. Anyone potentially eligible for Medicaid will be shown first, followed by those eligible for financial help. Advanced premium tax credits lower your monthly premium, while cost-sharing reductions lower your out-of-pocket costs. Each plan you see will show the premium with all financial help applied, the deductible, and the out-of-pocket limits. If you are looking for something specific, easily filter your search by metal levels, insurance carrier, or cost. If you need to, costs for more specific things are located within the plan itself. And as always, contact us and we'd be happy to help you with additional information.
Great, thank you. So before we get to this next slide, I just want to remind folks that feel free to post a question in the Q&A of the chat here, and we will try and answer that at the end of the presentation. All right. So let's talk about financial assistance, because that is a really important component of open enrollment and Vermont Health Connect. So we'll start, there are different types of financial assistance, and they obviously help you lower the cost of your health insurance or your payments for healthcare services. So we can talk first about premium tax credits. So premium tax credits are in advance. They're taken in advance, so you pay less each month for your health insurance premium at the end of the year when you file your taxes, or part in advance and part at the end of the year and when you file your taxes. So these help you, I'll say it in a different way. It's based on your federal income taxes. Many people take this tax credit in advance each month to lower their health insurance premiums. But like this slide says, you can also take the tax credit when you file your tax return, or you can take it in a combination, part when you file your tax return and part in advance. Let's go to cost sharing reductions. Cost sharing reductions reduce your out-of-pocket costs. This program is only available with specific silver level plans. Cost sharing reductions are designed to reduce your medical costs by lowering deductibles, copays, and max out-of-pocket limits. This means your insurance company covers more of your medical costs and you pay less. Your income determines which specific silver level plan and the amount of cost sharing reductions you qualify for. And then lastly, we have Vermont Premium Assistance, which is money from the state of Vermont that lowers your premium. And again, that's your monthly health insurance bill that the premium is. The state sends your Vermont Premium Assistance to your insurance company for you and lowers your health insurance bill by about 1.5% of your household income. Many Vermonters are eligible for assistance, and again, it's primarily based on your income and family size. So getting financial assistance is simple when you apply through Vermont Health Connect for a qualified health plan. The application process will help you determine what you're eligible for. A crucial point to remember when you're receiving financial assistance is to ensure you keep us informed of any changes to your information, especially income or family size. This ensures that you receive only the amount of financial assistance you qualify for. If you receive more tax credits than you should, you may be required to repay them at tax time. I can't emphasize enough, if you have questions about financial assistance or you need help with the application process, we're here to help you. You can reach out to us at any time, and we can help guide you through the various steps. So when it comes to financial assistance, know that there are options available to make healthcare more affordable for you and your family. I'll send it back to Stacy.
Thank you, Zach. Let's now get into the practical steps of enrolling into a qualified health plan through Vermont Health Connect. I see some questions coming into the chat, and that's great. Keep them coming if they come up. And again, we'll answer those at the end. So like I said, we're going to talk about how you enroll once you're ready. And we want to make sure you're well prepared to navigate the process smoothly. So that being said, our recommendation for applying is to do it online if you can. You'll need to do it on a computer. Doing it online offers the convenience of enrolling from the comfort of your home, and it's accessible 24/7, making it better for busy schedules. So to do that, you'll start by creating a Vermont Health Connect portal account if you don't already have one. On a computer, navigate to vermonthealthconnect.gov and click the orange login button at the top right of the screen. It's a one-time setup, and your account will be your portal for both applying for and maintaining your coverage going forward. So it's a really great resource. Once your portal account is set up, you'll follow the instructions on the screen to apply. And when you submit the application, it should tell you immediately what you qualify for. If that's a QHP, then the exciting part begins. And because you use the plan comparison tool, you already know what plan you want, so you can make your selection, and then to officially activate your coverage, you'll be paying your first premium. The instructions to do all of this will be provided on the screen. And if you remember back to the beginning of our presentation, you need to make your plan selection and that first payment by December 15th to have your insurance begin on January 1st. And that's it for doing it online. But remember, it's crucial to maintain accurate and up-to-date information in your Vermont Health Connect account. If any changes occur in your life, such as income or family size, be sure to update your information promptly. And again, it's super easy to do that in this portal if you make that. Doing this, make sure that you are receiving the correct amount of financial assistance and prevents any surprise bills at the end of the year. Now, if online isn't your jam, there are other options for enrolling. You can do it by paper. You can print an application from our website, or you can call us and we'll mail you one. Just fill it out and mail it back to us, and then you'll have to be on the lookout for a notice in the mail, which will be our reply that tells you what you're eligible for and provides you the next steps. You can also apply by phone. So if you prefer a more personalized experience or have questions along the way, our knowledgeable service representatives can guide you through the process and address any concerns. Doing an application over the phone does take a good amount of time, so you'll want to be sure to set aside some for that. And then the third option, my personal favorite, is if you prefer a face-to-face assistance, we have in-person what are called assisters who are ready to help. They can meet with you, answer questions, and provide guidance throughout the enrollment process. They can also help you maintain your coverage going forward. Assisters are not state employees, but they are certified by Vermont Health Connect. They're partners out in community organizations. Meeting with them is always free and it's confidential. So whether you choose to enroll online, over the phone, or in person, we're here to make sure you have a smooth experience. So we're getting towards the end, and we're going to answer some common questions that we see here. The first question is, how do I find out if a plan covers my medical needs or prescriptions? So you can do that with the plan comparison tool. It was a little quick, but if you noticed, when you're looking at the plan comparison tool and you get to that list of all the plans on the exchange, you can actually click into plans that you're interested in and kind of read everything that they cover, kind of all that small print. But if that feels too overwhelming, you can actually call the insurance carriers directly, which might be even easier. So if you have identified a few plans with the plan comparison tool that interest you, you can call up those carriers and say, hey, I'm interested in this plan. Can you tell me if it covers my exact medication or my providers are in network? So that's what we recommend for that. The second question we get a lot is, what if I end up needing insurance outside of open enrollment? For this, there is something called special enrollment periods, which are a time outside of the annual open enrollment period when you can sign up for health insurance. To qualify for a special enrollment period, you have to have experienced certain life events. Like loss of health coverage, getting married, having a baby, or adopting a child. Those are just some examples. For more information about SEPs and other life events that could qualify you for one, you can visit our website. Again, that's vermonthealthconnect.org, and we have them all listed there. The third question is, how do I manage my financial assistance? Anytime you have a change in information, like welcoming a new family member by birth, adoption, or marriage, if you move, and especially if you have a change of income, even if it's small, you should let us know. You can do that in your portal account or by giving us a call. Keeping your information up to date, and I know we've said this before, but keeping your information up to date with us will ensure that you consume only the amount of financial assistance you qualify for throughout the year and avoid needing to pay back any money at the end of the year. One change people often forget to tell us about is if they have a change to the tax household, like an adult child is no longer claimed as a dependent. So if there is ever any doubt about whether you need to let us know about any changes in your life, you can always call just to be safe. Enrolling in a qualified health plan is just the start of your healthcare journey. Staying informed and up to date is key to making the most of your insurance and maximizing your well-being. There are several ways to stay connected with us, Vermont Health Connect and the department. First and easiest is to check out our website, vermonthealthconnect.gov, to read all about qualified health plans and other types of insurance available in Vermont that we didn't cover today. You'll also be able to find the recording of this town hall on our website once it's up and ready. Next, you can follow us on Facebook. We post a lot of short and digestible educational content, so it's a great place to get a small weekly, daily dose of insurance information. And then finally, you can also follow us on Twitter or YouTube. So our key takeaways from today, how do I get back to my notes here? Our key takeaways, open enrollment is November 1st, 2023. That's today. Open enrollment is today through January 15th, 2024. Second, financial help is available. Third, use the plan comparison tool to estimate financial help and browse plans. The plan comparison tool will be your best friend in kind of looking through your options. And lastly, we are here to help you. You can call us or you can look on our website. Zach also mentioned that we have an inbox. I think he can share what that is for questions. But these are our key takeaways. Again, open enrollment is November 1st, today through January 15th. If you want a plan that starts on January 1st, you need to pick it and make that first payment by December 15th. So we've said this a lot, but with specific questions about your unique eligibility and circumstances, you can contact us at 1-855-899-9600. With inquiries about this presentation or to get in contact with Zach or myself, you can email our general inbox, which is ahs.vthealthconnect@vermont.gov. To access the portal, find the answers to many common questions, and later find the recording of this presentation, you can visit our website, vermonthealthconnect.gov. If you don't have any questions and you want to drop off, you're more than welcome to. Thank you so much for coming. I think, Zach, you and I should stick around for maybe a minute longer to see if any more questions come in. But otherwise, thank you for being here.